up the cross-linking during pregnancy approach?
Good morning, one and all, and it's a pleasure and privilege to be talking in front of such a learned audience. So the question posed today, would you do cross-linking in pregnancy? And I would most certainly say, let's wait. Is CXL harmful during pregnancy? This is probably the first question anyone is going to ask, and my opponent is going to ask as well. The true answer is, we don't know. Clinical acumen might tell us that it's probably not going to affect the pregnant lady or the fetus, but then we don't have any compelling evidence, any studies showing the outcome of cross-linking done in a pregnant woman. And then the medico-legal aspects as well, which we are all very well aware of. So before we really go analyzing the safety of CXL, let's really look at the risk of progression in pregnancy itself. Keratoconus progression in pregnancy, a lot of hormonal implications, not very well understood, but at least relaxin is one of the major hormones implicated in this. And the peak of relaxin hormone is only during the last few weeks of pregnancy. And we could easily wait and watch those last few weeks and do the cross-linking once the woman has delivered. So subsequently, the next thing is, how much does actually keratoconus progress during pregnancy? Studies have shown that on a mean in a pregnant woman, the increase is about 1.4 diopters in the SIMK and 1.1 diopters in spherical equivalent with no change in the RGP which they were already wearing. This 1.4 diopters in SIMK is just barely above the test-retest variability of an OBSCAN or a pentacam in a keratoconic patient. And these 1 diopter flattening which we may require, whatever increase has happened during pregnancy, can easily be done by just a cross-linking alone, which can be done very well after pregnancy. And what we really must ask ourselves is, we have shown topographic progression, but is that really clinically relevant to a pregnant mother who cares about nothing else but the child in her belly? Is the progression even permanent? Dr. Hafezi has shown that in studies that these are often transitory changes which are reversible once pregnancy and lactation wears off, and much of it reverses. Not only this, increase in curvature, decrease in pachymetry, myopic shift of up to 0.9 diopters is reported even in a normal non-keratoconic eye. So keratoconus in pregnancy, minimal progression, potentially reversible. You may have a topographic change, but then is it barely clinically significant for the mother? And let's avoid all medico-legal aspects. If the child is born with some deformity, it's natural for the mother to think that this is, it could have been contributed by the cross-linking done during the pregnancy. Could she have just kept calm and just waited?